Welcome back to CLE Weekend. May is Mental Health Awareness Month. So this is something that is so important, near and dear to my heart. We're joined today by Leanne Cornian, Director of the Ohio Department of Mental Health and Addiction Services. We're going to talk about the 988 Suicide and Crisis Lifeline and why this is so critical. So Leanne, let's start with what the 988 Suicide and Crisis Lifeline is.
988 is Ohio's Suicide and Crisis Lifeline, which we launched in July of 2022. And since that time, more than 500,000 Ohioans have reached out to 988 for help and support when they are struggling with their mental health and mental well-being. And we're really proud of our 988 system here in Ohio. We have 19 call centers all across the state with more than 400 compassionate, incredibly well-trained staff who are answering phone calls, responding to texts and chats every single day here in Ohio.
And who is on the other line? I mean, who answers that call?
These are incredibly well-trained professionals. Sometimes they're individuals who have lived experience themselves, or sometimes they're social workers, counselors, therapists who are there to help individuals when they need it most.
Leanne, I want you to give us some examples of why people would be calling 988, maybe what they're going through, right? So we kind of know, or if we have someone in our life who's going through a situation, we can encourage them that there is an immediate outlet for them when calling 988.
Sure. So because the title of our lifeline is the Suicide and Crisis Lifeline, obviously we want 988 to be a resource for any Ohioan who is contemplating suicide, who's thinking of harming themselves or someone else. But it could be a breakup. It could be trouble at work. Maybe you recently were terminated from your job, or you're experiencing financial stressors. Or you have a loved one and you know that they're just acting a little bit differently. Maybe they're more reclusive. Maybe they're not finding joy in the things that they used to love doing. And you need help, you need support, you need some guidance on where to go. 988 is always a resource for Ohioans who just have questions about their mental health or the mental health of someone that they love.
Okay, and when we do, what can we expect on that call?
When an individual picks up the phone and dials 988, they're going to be given a few options for specialty lines for individuals who are not native English speakers or for our veterans. And then if they don't select one of those lines, within about 25 seconds, they will be connected to a call taker right here in the state of Ohio. So in less than 30 seconds, they are connected to a compassionate person on the other end of that line who is really just going to listen. They're going to help de-escalate that situation and try to provide support and connections if they're needed to community behavioral health services so that person can continue to get the help that they need.
Why is this more important now than ever?
We know that Ohioans are struggling with their mental health. We know that mental health conditions are real. In fact, 1 in 5 adults and about 1 in 5 children nationally struggles with a mental health condition every single year. That's 2.2 million Ohioans who are struggling with mental health challenges. So we know that mental illness is real, but we also know that with the right treatment, preventative services, and recovery supports, Ohioans can continue to live thriving and fulfilling lives, even with their mental health condition. So we want to ensure that every single Ohioan knows that it's okay to not be okay, but help is out there if you need it. And it's just a phone call away at 988.
And there is a difference between calling 911 and 988.
Correct. 988 is Ohio's Suicide and Crisis Lifeline. It's an opportunity to receive mental health supports without law enforcement response. When someone calls 911, really they're looking for law enforcement or the fire department or someone to come out and assist them. The whole goal of 988 is that we don't necessarily need to send somebody to respond. We're able to manage the vast majority of calls coming into 988 over the phone, and no follow-up response is needed from 911 or from mobile crisis services.
It is an important number too for everyone to know. It's just not people who are dealing with mental health struggles, but everyone.
Absolutely. Individuals can use 988 for themselves, for someone that they love, It also is the gateway to our new mobile response and stabilization services, which is our statewide mobile crisis response for young people. So it can be used by schools, by libraries, by families, by caregivers to make sure that if a child is experiencing a behavioral health crisis, help is no more than 1 hour away.
Well, let's talk about Ohio. Are we meeting the needs of the people who are struggling with mental health and substance challenges?
Absolutely. 988 is designed for anyone experiencing a behavioral health crisis, whether that is a mental health challenge or a substance use challenge. So anyone experiencing one of those can pick up the phone and call 988. But also under Governor DeWine's leadership, we have really tried to build the system, the community behavioral health system of care that was promised so many decades ago. And we have been investing every single year in creating more access so that individuals who need help can get it as close to home as possible.
And we know you have been working to spread the awareness of this life-saving resource. And this July, it's going to mark the 3rd anniversary for 988. How is it going?
Well, we think it's going very well. As I mentioned, we have fielded more than 500,000 contacts, that's calls, texts, and chats, since we launched 988 in July of 2022. Just this year in 2025, we are fielding more than 19,000 contacts every single month. We know that 988 is saving lives, and we're very proud of the work that we're doing. In fact, Ohio is a national leader in 988. Our speed to answer rate is better than the national average. It's less than 30 seconds, and less than 1% of calls coming from Ohio into Ohio call centers roll over to the national backup providers. So we are answering calls right here in the state of Ohio for individuals right here in the state of Ohio. And we know that this is helping the behavioral health needs of our state. In 2023, for the very first time in several years, we saw a reduction in the number of suicides. And that was better than the national average. So we're very proud of the work and the impact that 988 is having.
Leanne, thank you so much. We'll be right back here on CLE Weekend.